right, guys, today we're going to be talking about a drug. I like to use it as a calming effect drug. There's some people in seizures, they swear by it. I'm not exactly sold. But let's get to it, which is Mad Medic's Guide to Lorazepam here. The reason I say chilled to perfection is because guess what? We do chill it to perfection because it stays in our refrigerator, which is why a lot of people don't have them on the trucks, have it on the units. Again, it's also known as Ativan. It's an anticonvulsant, a sedative, and a hypnotic, and it is a benzo. It's an anticonvulsant, again, sedative. Again, it works very well, and it works on the type A GABA receptors. And it has no direct effect on them, but it does potentiate the effects of the GABAs within the brain. And basically, it causes levels of sedation with no analgesic properties. Let me say that again. It doesn't do anything for pain. You forget that you're having it, but it does not do anything for pain. Why the docs kind of like this is because it's got a less of a half-life than Valium does. That's why they like it. So it can pretty much wear off and your patient will go back to normal within a lot faster than if you give them Valium. Valium, you're looking at a couple hours. Okay, so, and again, it suppresses the spread of the seizure activity through the motor cortex of the brain, and it does not appear to abolish the abnormal discharge focus, so it doesn't get rid of the spot, but it kind of reduces everything around it, which allows the seizures to stop or to subside. It's 1 to 5 minutes when you give it, and then duration is 6 to 8 hours, and I will tell you, it probably wears off a whole lot quicker than that. I would say probably where the patient's back to a functional state, probably within maybe 45 minutes to an hour. They're still going to have the effects for about 6 to 8 hours. But again, Valium, you're talking a lot more time there. And again, we use it to control status epilepticus, recurring seizures. And again, we usually use this as a pre-medication before cardioversion. And again, the thing to remember about it is, though, guys, it doesn't take away pain. It has them forget that you ever did anything painful to them. So again, there's no analgesic properties to it. Again, like any good benzo, it's going to make you sleepy. It's going to change. It's going to cause coma. It's going to cause you to forget things. It can cause a little bit of a headache. Again, good news is they'll forget about that they had it. Again, it can cause psychomotor impairment. It can cause delirium also. But the big thing is it definitely slows down the blood pressure and then slows down the heart rate. And so if you've already got hypotension, you probably need to stay away from this one as well. It definitely will cause respiratory depression. And again, you can't cause apnea with it. There's certain places they'll just give them a bunch of Ativan in order to snow them in order to get them intubated. It's a way to do it. Again, don't give it to somebody that's got glaucoma. If they've got sleep apnea syndrome, probably not the drug to give. If they've got coma or shock or they're suspected of drug abuse, we don't give it. And again, if they've got respiratory insufficiency, you probably should stay away from it. It can cause some reflex bronchospasm with it, but again, and especially with our RSI drugs, it can cause some major issues. So it's one of those risk outweigh the benefit questions as you're making that clinical decision. Again, it does do a lot of other CNS depressants. It mixes very well with them, and it definitely mixes very well with alcohol, so it will potentiate the effects. Okay. Again, watch your respiratory rate. Blood pressure should be diluted in normal saline. I usually, when I draw it up to 1 milliliter, I usually put it into the rest of it into a flush so that I can have a little bit of control. Your antidote for it is Romazicon, okay? And again, it should be available if an antidote is required. If you don't have the Romazicon available, make sure that you've got your bag out and ready to go, because that is one of the weird things. And you need to have your advanced airway equipment ready and available just in case this thing completely knocks out the respiratory drive, which I've seen happen a couple times, all right? Don't give it in the arteries because it can cause a vasospasm, and it can cause the vein to go, or the artery to go gangrenous, and that will require amputation. Again, it requires about 6 weeks if not refrigerated. If refrigerated, it has a normal shelf life. So we keep it in the fridge, okay? And again, these are usually given 0.5 to 4 milligrams. Usually 0.5 to 1 is all I usually ever had to give. And I usually gave it for a calming effect. I didn't really give it to I know some people like to give it for doing an RSI. I'm not actually a big fan. I think that we got better agents. Versed ketamine, I think or etomidate work much better than this guy right here does. But I do know some docs that they'll, I want to give this. Okay, we're good. Again, you can repeat it about 15 and 20 minutes, and the maximum dose is going to be 8 milligrams. And again, repeat your dose in about 15 to 20 minutes. And again, that max dose again is 8 milligrams. Your pediatric dose, usually 0.1 is kind of the middle of the road there. You give it nice and slow, repeat it in 15 to 20 minutes. Your max dose is 0.2 milligrams per kilogram. It can also be given rectally, 0.1 to 0.2 milligrams per kilogram. If I give it rectal, I usually go big. I go to the 0.2 and let it absorb in there. The way to give it, again, you can give it IV, IO, IM. It can be given rectally. If they're pregnant, stay away because it does have adverse effects on the human fetus, okay? Again, we got other drugs we can use, all right? So stay away from the Ativan. My biggest thing that I used Ativan for, guys, is if I needed to just chill somebody out and calm them down. It wasn't as bad on the blood pressure as Versed was. And that's kind of why I liked using it for that purpose. But again, if I'm going to RSI, again, I've got etomidate. Usually, etomidate's a much better drug in the very, very short-term setting. This is one I just kind of wanted to keep mellow for maybe a 45-minute to an hour trip. If we were doing a long-distance transport with somebody that got easily agitated, I'd give them a milligram of Ativan before we left the hospital. That was kind of the way that I did it. All right, so again, Ativan, it's got its uses, it's got its place. Again, it's not as bad on the blood pressure, but I don't think that it works as well as your Versed it does. So keep those in mind. All right, so like I said, choose your benzodiazepine wisely. All right, that's it for today. We'll talk to you on the next one.